Hello, everybody. My name is Anthony Tassoni, and I'm a pharmacist and co-owner of a pharmacy in southeastern Melbourne and the Victorian branch president of the Pharmacy Guild of Australia. And I wanted to take this opportunity to give you all some tips to help look after yourself during this COVID-19 pandemic from a pharmacy perspective. So many of you may take prescription medicines on an ongoing basis, and you may not be aware that your pharmacy can keep your prescriptions on file at the pharmacy, and you can actually ring ahead, or some pharmacies have phone apps that you can actually order your prescriptions from a phone app in advance so that they're ready for you to pick up when you are ready to get them. So this might help save you waiting at the pharmacy itself, because we're trying to encourage social distancing at the moment during COVID-19. And some pharmacies also provide a home delivery service. So if that's something that's of interest to you, ask your pharmacist if they do offer that service. And having your prescriptions on file at the pharmacy helps them manage getting those together for you on demand. So keep that in mind whilst we're going through this COVID pandemic and we're having to social distance. There's also been calls for people to get their flu vaccinations done as we're heading towards winter. And you might find that from some pharmacies and doctor surgeries that flu vaccinations may be difficult to come by due to the really big demand that we've had so far in 2020. In my pharmacy, and I've heard similar from other pharmacies, we've done more flu vaccinations this year already compared to the whole 2019 winter, which was a bad flu season last year. But it is still a good time to get your flu vaccination done. So if you haven't already had it done, speak to your doctor or pharmacist. And if they do have stock available, they'll hopefully be able to give that to you in an appointment. But if they don't have any stock available, perhaps put your name on a waiting list, because there is going to be a large amount of flu vaccines arrive into the country in the next month or so, because the federal government have done a really big order of another 3 million doses of the vaccine. And the thing with the flu as well, because of our social distancing that we're doing at the moment to try and combat COVID-19, it's actually reducing the number of flu cases in terms of transmission of the virus and the really good hand hygiene that we're undertaking at the moment. So we're actually protecting ourselves against the flu at the same time as protecting ourselves against COVID-19. But you do need to be aware with the flu vaccine, it doesn't protect you against COVID-19. That is a separate virus that we're still trying to develop a vaccine for. But getting the flu vaccine is the best way to protect yourself against the flu. It's not 100% effective, but it is a really good thing to get. And you can't catch the flu from the flu vaccine. So just to be aware, that is an urban myth, but you cannot catch the flu from the flu vaccine. And just some other tips as well. Due to there was an increase in demand from pharmacies for prescription medicines as people were trying to prepare themselves for being at home more throughout March. You might have found that it was difficult to get some prescription medicines that you were taking from your pharmacy because they may have been temporarily unavailable. So just speak with your local pharmacist about what your needs are, and they will try their very best to be able to get that into stock for you. They might need to offer a different brand of what you typically take, depending on the availability of different brands of prescription medicines, and trying to keep ahead in advance of when you are actually running out of your medicines is a really good idea, just in case things are temporarily unavailable. There isn't a need to stockpile or get large quantities of medicines. We're not asking or recommending that at all. That's not a need to do that, but just speak to your pharmacist if you have any concerns or queries about your prescription medicines. In the meantime, hope you keep safe and keep your distance where appropriate, and we're all in this together and we will get through it together. Stay safe and all the best.